Good. Everyone's hooked up. So I'll call this meeting of the Price County Health and Human Services Board to call it to order. And we'll have the attendance. I sound like school here. The roll call.
Good morning. I got word from Joe Baratka. He will be in a little late, but he will be present. Paula Hodek,
Here.
Robert Kopish, Patricia Stephen,
Here.
Dennis Wartko, Nicole Kolwicki is excused, Sally Hummel, Suzanne Acker, and Gerald Swenson. Thank you.
Okay, let's have a reminder that we use our microphones too then, please, so the people can hear. And I know I listen online a lot of times, and boy, there is a difference if you're not using your microphone. So if you could do that, that would be great. All right, let's go on to public comments. Are there any public comments online? Do you see anything? *6, if so. Nope. Okay. Anything in any public comment? And well, you ladies are going to talk anyway. But, okay. And any communications from the board? No. All right, let's move on. The vouchers have been going around, but we'll have to wait yet for Joe Baratka to get here. All right, Chrisanne.
So Mr. Kopish had only 3 questions this time. And
What time do those come in?
6:48 last
Okay.
night. So
Oh, last night.
last
Oh.
time it was like 5 in the morning. Right?
Ah.
So the first one was there was a family care invoice for the total was 187,000, but it's for our annual family care contribution. 8 months of it or 9 months of it goes into 2025 and 3 months goes into 2026. It just runs April to March, but we pay that every year.
So the 180 some thousand is basically what it costs us every year for the family care?
That's a required.
That total is roughly what our total
A
cost
required contribution. I don't know
Yeah.
how they split it up, but yeah, and we've been paying that for probably since
long time.
2009 or 2010. Yeah.
Yeah.
That's when they broke it off. It was whatever your yearly contribution was, they maintain that going forward. So like our county was whatever you said, 100 and whatever. So then that's just our base payment.
Right,
And
never
then
changes.
The state or
And it
whatever.
stays like that. It's
Mhm.
not, doesn't go up with time or anything.
No.
Okay, all right. All right, thank you.
Next one was a question about the BART bus. That was our annual share of BART operations. So that included Park Falls, Phillips, and Woodruff. So that came to 90,000 total. And
The
that's
reason I asked is it showed up on 2 different runs.
2 different what?
The 90,503 was on batch 4 and
Okay.
batch 7. It was on there twice.
Let me look at batch 7. A different amount on batch 7?
No, the same amount.
Oh,
both
then I
times.
must have maybe I ran the wrong report.
Was there a whole bunch of stuff that was doubled up or just this time?
Well, I noticed that because it was $90,503.
I possibly sent the wrong.
It might have just been,
report.
might have grabbed a date that doubled up some of them.
Yeah,
I
but yeah, we only
was
did pay it
concerned
once.
that we paid it twice.
No, only once.
Okay.
Honestly.
We would have caught that on the other end too.
Yeah, and it wouldn't let me enter an invoice twice
Doubled up,
anyway.
yeah.
So
And then
yeah.
treasurer's office would have caught it if there's not another invoice
Yeah.
with it.
I'll check though. I think maybe I just printed off the wrong committee report for you.
Well, if you would just shoot me a note then.
Yep.
Okay, thank you.
And then the last one was just a question about Lutheran Social Services. We have a 16-year-old that's in residential care there, and he's been there since August. So
So that's the same client or whatever you call
Yeah.
them? Yeah,
Mhm.
okay.
yep, there's just one there right now. So.
So that's a per month then, about 20 grand?
Mhm.
Okay, thank you.
Any other questions for Chrisanne? Oh, we'll wait until Joe gets here. So
And
we
then you'll
can-
get signature
yeah,
on.
We'll get
Okay.
the signature from
Okay.
him.
Thank
and
you.
Then we'll, okay, I'll make a note to not forget that.
And then you can pass it on to Robin and Carrie. They get it after
Oh, they do?
Yeah.
Okay,
they file it.
all right. So you
Thank
don't need it back at all?
Mm-mm.
All right,
Nope.
we'll do that then.
Thanks.
Just a quick
Sure.
question. If I didn't ask any questions, would you come to the meeting anyway?
Well, yeah, I want to see you.
Oh, okay. All right.
Of course.
Thanks, Chrisanne. All right, so we have committee appointments. We have Sally Hummel, her term was 6/1/2026 through 5/31/2029.
Excuse
we
me,
ch-
Paula.
Yes.
Sorry. Did you want to wait for Joe for the minutes or did you want to number 3 meeting minutes?
Well, we could do
Okay.
the minutes. It's just the vouchers we need.
Okay.
Yeah.
Thanks.
I think. Yeah. Yeah, okay, so we will do the minutes then. I would need a motion for the minutes,
I make a motion to accept the minutes.
okay?
Second.
And second by Dennis. Is there any discussion? Hearing none, take the vote. All those in favor? Aye. Those opposed? All right. Second is good. Got it. All right. I'll take that off then when Joe's here. Committee appointments. So should we combine 4 and 5 and just make a,
4 would just be, so it's in the minutes, because that's a letter from, that's an appointment by the
oh,
county
that's an
administrator.
appointment. Okay. So we'll just do that. So we need a motion for Sally Hummel and her appointment. We're nice to have Sally back. She wasn't sure, but she's sure now.
I'll make a motion to appoint Sally Hummel.
Okay, motion's made by Ms. Stephen. We can just recognize that we don't need the motion for an
Yeah,
appointment.
so this board is appointed by the county administrator's position. Obviously, we work together to pick who it is, but it needs to be in the minutes so that there's a recognition of it. Already got the letter. She's already got the
Okay,
appointment.
okay.
I do have a question.
Yes.
The 6/1 date is a new date, right? It used to be 5/1.
Mm.
So is Sally's current term, is she done at 4/30? So should this term be 5/1 to 5/31 to make that end date a new end date?
Mm,
Oh, there's one day missing, is what you're saying?
It's only
Well,
one
she'd
day,
be
yeah,
missing,
a
she'd be
day.
missing the month of May, wouldn't she?
No, it says,
Oh.
oh, it does say 6/1. Yep, I was looking at the next one that says 5/1. Do you know what it says on, in the letter's probably
It's a
right,
term.
so the minutes would just.
Hold on, let me look.
Because then she wouldn't be on the board for a month.
What is her full term?
Because I thought our terms now are 5/1 to 4/30.
I thought it goes to 6/1. I know you sent that message to me and asked about that, but that's when we changed that because we were like lame duck when I wasn't,
Yeah, it was a timing thing because we thought the full board had to accept these positions and I don't. It's on a list of
about
appointments.
clear as mud.
Okay,
You know.
so it has on the list May 3 years, 5/31.
Say that again.
It says May. It's a 3-year term starting in May 5-31.
This says starting 6/1.
Okay.
Well, I don't know what are you looking at?
It's our list of all the appointments and the dates that happen.
Somebody has their
When?
phone next to there.
Or is that when it ends? The title is when. Hang
Well,
on.
Either way, so we'll
So
look
far.
at it after.
Well, I know it used to be January 1st and we changed it to coincide with the board. So board appointments, you know,
I'd have to go look at the bylaws.
5-31. Is that when it ends?
It doesn't give a start date, does it? Is that the start date?
How is it here? Because NAC should be correct. That's 4:30 it ends.
There
Let me
ends in
see.
April and this starts,
So this is the end date.
starts.
This is when it ends,
It's the end of it.
I believe.
So this is the start date. So where did 6/1 come in?
This is the end date.
Health and Human Services.
Good check.
Yeah.
Once my master's.
It
We have-
says term shall begin on June 1st and extend through May 31st of the 3rd year. Yeah, so that's where we would have got it.
And that came from,
That's in your county
Supervisor
board
book, yes.
handbook, yeah.
right. It is correct on here then. And that was changed because there was that.
There was a timing issue.
Yeah, nobody could, I remember Jean saying, well, Paula's now not chair because it's open right now until the elections, remember? And so nobody could approve the agenda or put it together. Remember, that was kind of a, so this came back to the county board.
We can look at Sally's old letter too, to see what her end date was supposed to be.
Okay,
I don't. I
on
think-
the board,
Does
Sally.
Jules have those?
Her end date, thinking, oh, no.
So what does that do for this motion if we got to check it out?
You don't have to do any motion. The appointments, county
it's just
administrator
recognized.
Okay, so
appointments.
this,
We're just
you're
putting
gonna
something
just
in the minutes.
validate you got the right dates.
Yeah,
Is that what
there'll
you're
be
saying?
something in the meeting minutes that I have made an appointment.
Okay.
So there's a
right.
record of it.
Patty, want to take your motion off the floor?
You don't have to motion anything.
Well, she made a motion. So you just.
It just
take
died
it.
lack a
Died,
second.
okay. Okay, now we're talking about end of, and dying. Let's not do that. Okay. All right, so Sally, you are appointed. And it is so noted. Sorry about all that. We'll get it all together. All right, so now we have subcommittee appointments on number 5. And thank you, Sally, for your service with us. Price County Nutrition Advisory Council. Terms are 5/1/2026 through 4/30/2028. Robin Nielsen, David Schmidt, and Danny Hoffman. And B, the Price County Transportation Coordination Committee. Terms 5/1/2026 through 4/30/2028. Patricia Seaven, County Supervisor. Marty will have to be changed now. And so we're going to look at.
Yep. So he technically will be there until we talked about this at TCC. The 21st, I think, is when they swear in the new alder at the city. So we'll work with the city to come up with a new name for that.
Okay. And we thank him for his service on that one. We will miss that. Jason McMillan from the Transportation Provider. And we have, it's not on here because this just came through TCC. Susan Stanky will be the Park Falls rep. Is that correct how that goes?
That is correct. And she's filling a vacancy her term would end 4/30/2027. So that's different from 2028. That's the only difference.
2027. Okay, thank you. Nick, do these need a motion?
No, you can motion that you agree with them or however
Okay.
makes you guys feel.
Does this go to
I can't remember,
county
Brian,
board?
were these your appointments? or
Correct.
mine?
Okay.
Yes.
Those are-
So we need it
It's
to
just like the previous one, I believe. It's just got to be board, committee acknowledgement.
acknowledgement. Okay,
You're recognizing them. They'll go to the full board again for the meeting minutes and
okay.
these,
it
some
doesn't-
of these were Brian's, some of these were the mine administrators.
So it doesn't need a motion to go to the county board. All right, so it's so noted. That's just an FYI, folks.
Well, it's just official for the record.
Official, right. Got it. Okay, I think we got that clear as mud. Tiffany is not here. She is gone, so we will not have number 6. And Kayla has a meeting shortly, so we're going to bump her up right after public health and have her give those. So Kayla, if you're here, you are.
Good morning. Okay, just going through the quarterly reports and I just brought a little bit of additional information. So first page is our 2026 Q1 report. 14 kids placed out of the county, 7 kids placed in the county, 38% drug-related cases. Are there any questions about those numbers? No. Okay. Next page is our types of placements and kind of explains the costs of those placements, and how many kids are at each types of those placements. Obviously, residential care centers are the most expensive types of placements, and I wish I could say that that number is going to decline, but it seems to be a trend of the group we're working with at this time. There's 3 kids placed in residential centers. One of them is expected to be, we think, discharged as like a 37-day assessment. So hopefully that youth will be discharged somewhere, either home or depending on the recommendation of the assessment. But it is looking like he would potentially be able to return home. So that would be a huge savings there. Are there any questions about that slide? Okay, and then as you can see with the third slide, Q1 report says that we're at 154,953, which scared me a little bit. But then when I did the math, it was 619,812 if it continues to have that trend on the year, which is less than last year. So that's good. I can't express enough just that out-of-home placements, I mean, the placement cost of any type of placement has increased, as have most other things. So, yeah, every placement that's outside of the home is pricey. We continue to struggle with finding local foster homes. So that increases the cost as well. Even some of the number on the middle slide says license, or it says, where are we here? A local foster care. 2 of those 3 children are placed in a foster home in Taylor County. We still labeled it as local foster care because that's pretty local, but we're using another county's foster home for 2 kids. So that's been a struggle. Because last time we had kind of gone over a little bit more information, so I just grabbed some more information of what we have going on in our unit. So TSSF is a funding source that I've talked about a lot of times where I think over the last maybe 3 years, we've received funding to help try to keep kids in the home. So currently we're serving 4 families with TSSF, and that is keeping 15 kids in their homes with that funding that otherwise would have been removed if we didn't have that funding. So those kids might have been more local foster home kids, or we would look for relative care providers. But with that funding, we were able to keep them home. Mostly, I think we're seeing that as homes that are not safe for kids to live in. We're helping them get them cleaned up as fast as possible, providing dumpsters, providing cleaning services, and then checking on them, increased social worker and family skills workers time to maintain those homes. We've also helped with first month's rent or security deposit if they've had to move out with those funds that were provided. So that keeps kids in the home if we can provide those services, and then keep monitoring it to make sure that that continues to go well. Let's see. I just wanted to make note that we pair with Chana's unit a lot with CCS, and that's been really, really helpful because we do see an increase of services for people with mental health in our unit. With youth justice, it used to be a lot more of the quote unquote naughty kids, the ones that were vandalizing and breaking into places and doing things like that. And now it seems to be more a mixture of cases of that and mental health. And so we're just kind of working together. Chana's unit has some pretty intensive in-home things that have been helpful for us to provide services locally and keep families together the best we can. But those are some of the toughest cases. So it is always teetering a line of who's gonna meet that barrier first, so we've had 66 CPS referrals so far this year. We've screened in and provided services to about 26 of those. The other ones were screen out or voluntary things. We've had 17 on-call situations. Youth Justice does a couple programs called On the Right Track and New Directions. We usually try to hold 2 of each of those a year. So far we've held an On the Right Track program and served 4 or 5 youth in that. We complete step-parent adoptions. So I think we have one of those so far this year and one at the end of last year. And so far this year, we've had 13 new youth justice referrals. So I think that's what I know.
I just have one more thing I wanted to add while Kayla was here. I had received a letter from the Department of Children's and Family wanting to recognize our agency's successful efforts at completing and documenting case worker contacts for children in out-of-home care. The efforts of our staff have directly contributed to Wisconsin's exceeding their federal requirement at least 95% of children in out-of-home care have face-to-face contact with a caseworker at least once a month. And it said Price County was one of the highest performing counties statewide. Price County demonstrated an exceptional performance of 100%. I don't know if anybody had any
That's great.
questions, so,
Yeah.
yeah.
That's great.
So Kayla, over time, are the cases getting more complicated or
I think different.
it sounds like it?
Yeah, I was just telling one of the workers, I'm like, in 10 years, I feel like we're going to see like a difference in even schooling of kids. Like, you know, we're dealing with a lot more kids with diagnoses of autism. I think locally we're struggling with that, whether that be the school, that's us, that's law enforcement. And we're receiving sometimes 4 referrals a week, juvenile referrals on 8-year-olds, 10-year-olds, really young children, because they're out of control. But I think we're struggling to know how to handle those behaviors because we can't place them all in residential care, nor should they all go to residential
Right.
care. And I'm not even sure that residential care is equipped to handle them because it's not exactly mental health. It's more of a, so up in Minocqua area, I had called recently just to learn a little bit about, they have a school that's more project-based learning for youth such as this that just helps teach them in a different way. And we don't have that locally. And I'm like, hey, what can we do to like open enroll? Well, they only accept their school district, but they are looking to expand. And I have no idea if I'm right or wrong, but I wonder if you'll see something like that in the future that will help serve these kids a little bit better because nobody knows how to handle these out of control behaviors. It puts us at odds a lot with the schools and with law enforcement because everybody sees it from their own light of what they're doing, right? So law enforcement thinks these are all naughty kids and they need to be placed, and school is up in arms at how to handle them. And we're saying, well, hey, you know, they're doing okay at home and they're doing okay in the community. They're just not doing okay here. So how do we help? And we're just kind of all at odds. It's been a little rough, but those seem to be the increase in our cases that none of us are super familiar with dealing with. And we don't have service providers for them. So
Yeah.
we're just struggling a little bit.
I see you're asking for another position.
Oh,
Oh, that's
Different area.
Shauna. Okay, I
Yeah,
saw the
I'm-
children's and I thought it was.
Kayla's like,
I thought
yeah,
it was
sure, I'll
you."
take one.
Okay.
yeah.
Kayla,
All right, I'm in the wrong place.
do you
Sorry.
want to expand one more little area on that where it's not only the cases, but the families and with social media or other outlets that they may be, like they're frustrated too, right? The parent or the caregivers.
You mean like,
Just how it makes your guys' job a little bit more difficult because there's a lot of rumors that get out real quick,
Yeah.
or even just it's one side of the story and the families may be frustrated and
yeah.
what you're seeing.
Yeah, I guess I kind of say that back to like, I think what we're learning, what we're learning at Health and Human Services is to stay in our lane, and we can only help in a certain area. So if all of our agencies would do that and we could collectively work together, it would probably be easier. But yeah, social media, I mean, nobody understands what's going on, and that includes us. We have our understanding of the way that we work with it. The school has their understanding, law enforcement has their understanding, and then there's the public, right? And so then that gets all put out to the public. And family members are scared and don't want these kids in their schools because, you know, it's being reported that they're hurting people and and, you know, a quarter of all of those things are true. So, right. So it's a struggle. Yeah. And it's a big push. Like I said, it's really hurting our relationship with the schools and with law enforcement because they want something done. They want, they have 4 people like on their list right now that they think should be in residential, and we don't agree. And we're trying to serve those families and the best we can at home, but it's not without a lot of tension and a lot of
And I think even if we did take it to court, it's for a placement, we wouldn't get it because they're not meeting that criteria for a placement. And that's something that I wish that we were trying to educate like school and law enforcement that the child, just because it acts out in the school, it's not acting like Kayla said in the community or at home. I mean, so the court would look at it as, why would you be ripping this child out of a home away from parents and when the needs are being met?
Yeah.
So it's a struggle with having everybody understand what our role is.
Welcome.
Definitely.
Thank you.
Thank you. Thank you. Okay. Dawn, for Aging and Disability Quarterly Report.
Tiffany's. We have Tiffany's quarterly report.
Oh, we're going to do Tiffany. Sorry, Dawn.
Yeah, yeah.
Okay.
I mean, so, yeah, Tiffany had just mentioned that she didn't think that anything has, like major information that she needed, explained. What's that?
Nothing's jumping out different.
Yeah, so.
Quarter over quarter.
She's not able to attend today due to a meeting. So she said, if you have any questions, if you want to look this over, I can get them to her.
It's the
It was right.
It's the Public Health Activity Report, the first quarter. That's the one, Sally. Okay, good. All right.
Then we go.
Yep. So unless you had questions right now, but if something comes up when you read through those, then jot it down and you can send it to Sarah or to Tiffany. Yeah, that would work. Okay, now we'll work on to, okay, Dawn, now you can come up. Thank you for Aging and Disability Quarterly Report.
Hi, everyone. So looking at the quarterly report under the ADRC, so at the top there, I don't think there's really been a lot of change in our numbers. They've stayed, similar to what they were the quarter before. So the only thing that's really changed is with the National Family Caregiver Support Program, we did get increased funding for that program. So we are opening up additional slots. So we're going from 7 to 10 slots. And then we're going to go up to each slot will be $1,500 that the people will have to use. So we're being a little cautious, but we are opening up more because they almost doubled what we got the year before. So that is one change. And then also we are able to use the Alzheimer Family Caregiver Support Program as a match for that national program. So we have started to do that. And that is simply, it has to be tied together in the Peer Place and the state documentation system. So we're doing that as well, using that as the match. So any questions anyone has about the ADRC numbers? Okay. So moving on then to the dementia care specialist. As you can see, support groups, memory cafes, all seem to be going pretty good as far as attendees. I really don't have a lot to point out in that area unless there's any questions under dementia care specialist.
Yeah, I'd like to ask, Park Falls Library Memory Cafe. What is the status or what's the process or how do you get that going?
So I know that Shay has been working with someone at the library trying to get that started. I don't know exactly where that's at, but I can certainly check on it and get back to you on that.
Well, I'm on that board and we
Okay.
have a meeting next week and we haven't really discussed that. So we probably should bring it up at the board
Okay.
meeting and just see what's going on. So that would be great. You
I'll
can get that
mention it.
stuff to Jody and she can talk about it at the meeting.
Okay.
Okay, thank you.
Okay. Anything else?
So it says here you're having, looking at possibly some memory cafes at the nutrition sites. How's that looking?
So I know Shea's been talking with them, but again, I don't know exactly where he's at with that.
Okay,
But certainly I can check further with him and, get back to you guys.
yeah.
Okay.
I think it's a great idea, just, wonder how far it's going yet, so
Okay.
good. Any other questions for Dawn on that? Okay,
Okay. So then the disability benefits specialist, so as you can see, she has 18 cases she's handling in Price and 19 cases in Sawyer. So monetary impact for the first quarter for Price was 134,551. So that is money that people are receiving in, like when someone gets their disability claim, that's money that's coming into the county in those federal dollars. So that is how they do the monetary impact, is looking at that money that would be coming into the residents of the county by her work. And then moving on to adult protective services. So, again, adult protective services has been very busy. We get a lot of referrals. And it seems like right now, they're getting more complicated all the time. A small number of guardianship cases are really taking a large amount of staff time because they're just very complex. A lot of times those cases have people with not only maybe that are elder, but also maybe have mental health concerns. So they are, they're just very intense and very complex and taking a lot of worker time. So any questions for me on adult protective services or the numbers?
okay.
Okay.
Hi, Joe.
So then moving on to the governing board meeting. Paula, were you present at that meeting? Yes, you were. Okay.
I was there.
So it seemed that was kind of a short meeting, and so I did jot down some notes. And one thing is Iron County had lost one of their ADRC specialists who moved on to a different position, but they did hire for that position, and so they are now fully staffed. So we are no longer having to cover more of the regional phone. So at the end of March, that went back to the normal schedule for regional phone lines. So we're not getting those extra days anymore. And then we did look over the financials, and at this point, they did not appear there was anything unusual about the financial report, but she was still waiting a bit until everything came in on that. But at this point, it looked pretty standard, that there wasn't anything that stood out. And then there was some updates on openings for the governing board, but none of them were for Price County. They were for Bayfield, and then tribal representatives for LCO and Red Cliff. One of the more, or I should say, one of the major talking points was the conversion that's going to be happening in July, when there's going to be a change to how our Medicaid billing is done for the ADRC. So that is going from the Excel workbooks that they currently do for their 100% time reporting to that being pulled out of Peer Place. So right now, all of the ADR staff are going under training to learn how to enter that time in Peer Place so it can be collected and billed through that system rather than having to do it through the Excel workbooks, which is an extra step. So the whole unit is going through training right now, different training sessions to learn how to do that. And then we're going to do double, and that was a decision by Natasha for the ADRC of the North. So we're going to do double billing for, not double billing, but we're going to do both the workbook and Peer Place for a while to make sure that we're all up and ready to go when we get to the due date, the date where it's going to switch over in July. Does that make sense? Okay. So as far as the governing board meeting, I believe that was kind of all my notes. Paula, did you have anything to add to that? Anything you?
Sorry, actually what I did was, I had 2 meetings that morning. I had with an enhanced the ADRC, and then I had to go, I had told them, oh, I was on a rate review group. Remember we were going over the rates, and it was scheduled for that morning at 10:30. And I said to Brandon, I wrote to him and I said, I may be late for that one because I'll be with ADRC. Well, like you said, ADRC was 19 minutes. It went really quick. So I was able to get back on with the rate review. And so that was, I'll discuss that when we talk about Woodland Enhanced. So no,
Okay.
I didn't have anything else. You did a good job on the ADRC.
Okay. Okay, so then moving on to the Woodland meeting. So, I did take down some notes, about changes that they are making at Clark County Rehab and Living Center. So it sounds like what they're doing is they're combining two of the adult male units together to make one unit that will be co-ed, because right now the female units are full. So what I got from that is they're trying to open more female beds by combining two of the adult male units and then have one co-ed geriatric unit. So that was a part of the discussion. And then the rate review group was discussed. So I don't know, Paula, if you want to.
Yep.
Okay.
So actually, that was a different day. That was on the ADRC day. And we did go through it. That was probably a 15-minute, 20-minute meeting as well. And I'll just read what the minutes say here. The rate review group met on 2/24 to discuss the rate methodology for WEHSHC to assure we were adequately funding out of the county placements to the Clark County Rehabilitation and Living Center. The existing reimbursement-based rate methodology adequately captures expenses incurred by the Clark County Rehabilitation and Living Center, resulting in no recommended changes in methodology at this time. So it was pretty cut and dry.
Mhm.
So we're doing okay.
Okay. And I know there was a budget update during that meeting in February as well, and I didn't note that there was anything
Mm-mm.
concerning or different that was brought up at that time either. And then the last thing that was discussed was some outstanding invoices with one county and what they were going to be doing about that.
This has been an issue for a while.
Yeah, it seems like.
We have Andy Phillips part of that too. So he came on and talked about that as well. It's with Walworth County. And again, they said there'll be a new update in August. So
Okay.
Yeah.
So then the August meeting was set for the 20th, and then that's when the 2027 rates will be discussed. And that is about all I had down for that meeting, unless you had anything additional,
no,
Paula.
I didn't know.
Okay. All right, any questions about any of that?
Yeah, yes.
So, I sit on a board for the Price County Ambulance Service, and they get quite a few calls to residents for, elderly people that have fallen down and need lift assist.
Mhm.
The ambulance service is asking if the ADRC has some information that they can provide to these individuals when they have multiple falls like this and they may need some assistance. I think they reached out already, but
They did.
I don't think we've received anything. Who should they direct their questions to try to get some information?
Well, me, and yep, I will be working on that and getting someone over there with, it might be a bit because of the change with needing to hire for Brenda's position and get somebody new in that position and trained. But certainly, yes, I will be in touch and get someone over there and we'll do some informational, like a informational session.
And that'll be good. And we're developing a policy also at the service for that. But it'd be good to have the information, like I said, for the services, and then also some criteria on maybe calling in for intake or something to that nature where the service can notify the Health and Human Services
Mhm.
that there may be an individual that may need some help.
Mhm.
So just the information on how to do that too would be great.
Okay,
All right, thank you.
yep. Okay. Anything else?
I don't think so.
All right, thank you.
Thank you, Dawn. Thank you. All right, Chris, with NAC and COA and ABC and NBC and
So, I don't know what to do first. The NAC update?
Sure.
Okay. So that meeting was held on January 29th, so a little while back. My report was we updated, gave updates on Peggy Call. She's the Park Falls Site Manager sub. We went over the financial report, the council member appointments, the program site reports. Pretty much all the sites are happy, except Kennan.
You're not happy?
No. So there was a lot of concerns coming out of Kennan. I won't go over them.
Okay.
You know.
I know.
So yeah, but otherwise everything is good at the sites. They went over their likes and a couple dislikes, but otherwise the majority are very happy. The home delivered, we get they fill out the rate your plates, and they also fill out when they send back contributions. There's a space at the bottom of the form that they can fill out their comments, and very rarely is there any are there any bad comments or anything. They're very thankful for the food they get. The next meeting is coming up again on April 23rd, and that'll be in Brantwood. So those are always exciting. The next, yes.
Hi.
Hi.
Just a question at the very top. Number of people received, we've got 72 people with 2,518 meals.
Yes. Oh, so that's on the quarterly report. Yep.
Okay, why are the numbers, they seem awkward compared to 167 people?
So
Patty, we're going to do that in the quarterly report, yeah, right? Or are you going to do that right now?
whichever.
Let's wait until then it'll just stay with the quarterly report. That's in number F. Yeah. So just hold it for just a second, please. Okay.
Okay. So then the Council on Aging, we had a meeting. This is way far back on December 8th. And that was held at the Peace Center. We went over the nutrition program, the financial report. That was when it was announced that the Phillips Cafe received the bid for the nutrition program for the meals. We pay them $5.45 per meal, and that was starting in January. The suggested contribution is $5.25 for congregate, and home delivered, the suggested contribution is $5.75. We briefly went over the Senior Living Expo, which was back in October. We had the presentation about the Edmund Fitzgerald, which was held last fall as well. The fall color ride we did. Students from the Prentice School District art class made Christmas cards too for the home delivered folks. Transportation update, there were currently 5 volunteer drivers. And the 8521 grant was completed. Let me see here. Memorandums of understanding, the MOUs were sent out and returned for the rental agreements at the nutrition sites. Some have rent and some don't. Let me see here. The Brantwood Community Center and the Peace Center charge $0 for rent. We pay $20 a day in Ogama. Kennan Georgetown Fire Department charges $300 per year.
So, and we pay at the Phillips Presbyterian, $200 a month.
And some of the ones that we don't pay when they have like equipment, so we've bought in refrigerators and dishwashers, and so it's kind of one of those, which one does
We
that
do
site
help out.
prefer? So like each site does receive some compensation, it just depends on in what form. So I know we're having a conversation on that at the next, whichever this one falls under, the meal sites, but that's just something to be aware of. So like I know all of them are like, well, how come some get it and some don't? We've offset that, so there is a balance. It's just how you receive it, because we can't do both, or at this time we don't have the budget to do both.
So then the next, any questions? Our next meeting, for the COA, that is also coming up, on the 13th. So that's right around the corner. And that'll be, over at the normal building. Any questions on that? So then my quarterly report is from the last quarter of the year, 2025, because I was absent on the last meeting. So the number of people that received home delivered meals in that quarter was 72 unduplicated people. So with that 72 people, 2,518 meals were served to those 72 people in that quarter. Okay. And for congregate, there were 167 people participating throughout those months, with 1,697 meals served.
Why does that seem unbalanced?
We serve a lot more home delivered meals.
I mean, are they getting like a breakfast, lunch, 2 meals?
No,
Oh,
so
some do get 2 meals.
Well,
It-
and also like home delivered are homebound, so they get it pretty much Monday, Tuesday, Wednesday, Thursday. And the
Yes.
congregate are ones that are optional. They can go to the
They
site.
come periodically.
so it's not 1-for-1 like ratio. So like if I counted as one of those 160 people that went to the congregate meal, I might only go 5 times the whole quarter, because I chose 5 random days, where the home delivery one might get a meal at 4 days a week, or will be 5th
Yeah.
if you get to double on.
Mhm.
So that one might count for 5. That's where it's not a ratio of like
Okay.
every person eats the same. It's
So
choice.
The 72 you said are individuals, but the 167 are
They're
Yep.
individuals, but
cumulative
they
numbers.
They don't come every day.
they just don't come every day.
Mm-mm.
Okay.
That's an example. I'm in that 167, but I don't
You don't go every day.
I don't go every day. Like this week I probably won't go at all, just because of the schedule. Whereas the home delivered, they pretty much are regular.
Yeah,
and They
yeah.
sometimes get extra meals for the weekend. and
Some
stuff, too.
get
Yeah,
2 on Thursdays.
Right,
Yep.
yeah.
Mhm.
Yeah.
Okay. All right. Thank you.
So the number of meals, I put the averages down for November and December. They're pretty close, in comparison. Park Falls is always going to be your highest, average of 39 meals. So, with Kennon and Brentwood a little lower. Transportation program.
I was going to say, I'm glad to see Phillips is up a little bit.
It's
Good. I mean,
Yep.
we were at 1 and 2 or 3,
Sure.
So
Yep.
That's good.
Yeah. Yeah, there have been more and more
Mhm.
coming.
That's
Not every
good.
day, but
Oh, right.
mhm. Newer people. Transportation, the 5 volunteer drivers drove 8,514 miles. They volunteered 287 hours of their time and took a total of 70 trips. But out of those 5, that was pretty much only 3 of the drivers, so they were pretty busy. The elder benefit specialist, she saw 115 clients and 23 new clients. Health promotion programming, there was 131 participants in the health promotion classes, and that included Mind Over Matter, Strong Bodies, and Eat Smart, Move More, Weigh Less classes. In the Mind Over Matter class, Cheyenne had a class over at Aspirus Duroy. And that was 3 sessions over there. And she just, I think, ended one up at the Peace Center in Park Falls. Strong Bodies, that's still going strong.
No pun intended.
The nutrition site programming in October was the Senior Living Expo, the Fall Color Ride, and emergency management visited. I think the site in Park Falls. November, we had Badger Talks, which was about the Edmund Fitzgerald. That was through somewhere in Madison. So we're working on that again. Not that same talk, but to have another speaker. And Kathy Shimkitz from NTC. She's been in Brantwood and she went to Kennan, and she's going to the other sites now. She has been this late winter, early spring, so going around to the nutrition sites in case any seniors need assistance. So
How's that going?
good, I think.
I bet so.
Hmm.
'Cause I
Yeah,
know they
I
always-
think she was going to every nutrition
Oh,
site.
good.
So, mhm.
Good to hear.
Yeah, and then this is just information about the Senior Living Expo that we've touched on a few times, so.
Do you want to mention that you do spotlight the drivers with a luncheon?
Oh, yeah, okay. So, April 21st, we're having our volunteer luncheon for the volunteer drivers that drive for medical appointments, and also for the volunteer home delivered meal drivers. So that we have one every year. We tend not to change. It's always at Marie's on Fayette. So, but yeah, so that's coming up on the 21st.
And it's well attended. I'm
Mhm.
real pleased to see that. And
Yeah, so
and then
that's
you
how
al-
we
you
kind of
always have door
acknowledge
prizes.
them.
That's nice.
Mhm.
Yeah, I think that's good to do.
Yeah. So otherwise, any questions?
Any questions for Chris? Okay, thank you, Chris. And Patty, TCC update, please.
Okay, Transportation Coordinating Bart. We held a meeting on Monday. Not too much new to report. We did make appointments. Marty Steven was appointed, but he'll be removed and we'll have another person. We've been reaching out to Butternut and Fifield. They use BART a lot, and Fifield has donated money in their 2026 budget, and Butternut is considering it in their 2027, reorganizing there. Our routes are constant and busy. We're continuing to offer free rides for veterans anytime. And in the summer, we are offering free rides for kids. Get the kids accustomed to riding on the buses, and we take them to the pool, or what is their thing?
So anybody under the age of 17, over the age of 6, or under the age of 6, they have to be accompanied by a responsible party. So it should be an adult, but it doesn't have to be. So anybody under 17 would be able to ride for free the bus. We see a lot of people go to like babysitters when there's swim lessons. We're working with the YMCA up in Park Falls. So if there's summer activities, youth camps, whatever that might be, they've worked with the school. So it's anywhere to a friend's house. It's just you call, set up the ride, and the youth ride for free.
Okay. We questioned the cost of fuel. It's not an issue now, and hopefully things will go back down a little bit. We talked about the electric bus that has been on order for 2 or 3 years.
Yeah.
We've discontinued working with the first company, and they're in talks with 2 new electric bus companies, so we're still progressing on that program. And I think that's about all I have.
I believe you had a question about comparison of electric to gas when you,
I asked about that. It's not real clear, but an electric bus works on a kilowatt hour, which is a lot cheaper than gas gallon, but the electric bus is more expensive to start with.
So the initial cost to get into the electric is slightly more, or is more. The biggest hurdle they're having right now with these buses that they're looking at is it's not to get into the weeds, but the movement of the bus is not the problem. It's the heating of the bus. So when you open the big doors all the time, the hardest thing for electric vehicles in general to do is heat, because it's like electric heating at your home. It's a high energy input to receive it. So the first company they they have a electric van right now that they use up in Ashland, and where they struggle is when they open and close the wheelchair area, because it just lets everything out and then they can't get it back up to heat, so you lose a lot of distance. But yeah, so when you look at the comparison between, how much you pay per kilowatt versus gas, there is a significant savings, and you can get your distance. It's just a matter of the heating. So winter's tough for a large vehicle like that. Small vehicles, it's not a big deal. It's quite efficient, but that's where the 2 companies they're working with, they're interviewing, because that's been a problem with one of the vehicles they have now, is not being able to maintain the heat.
and in your discussion on that, Nick, you mentioned also that the electric buses or electric cars, the drag of anything on the road.
Yeah, we got into the weeds because I have an electric vehicle, but what really, they're very efficient, but then the things that'll create less efficiency are like if there's snow on the road, because now you have friction, you're pushing through something, which same with a gas car, you just see it a little bit more in a electric. Wind is a big one, and a bus is not small. So that's where they're the inefficient,
Yeah.
but you're using these vehicles in town. So like a bus, there's not a lot of issue with wind in town. If you were to take it like on the Minocqua trip, that would be tough, because the slower you go, the more efficient they are. The faster you go, the least efficient, because you're pushing more, you have more friction, you have more all the stuff. So we got into the weeds with how.
So before you speak, Mr. Ernst, I remember when we voted on that, you were not so gung-ho on
Well,
that.
because I didn't think the technology was there.
Right. But this causes me concern now, because we're
Yeah.
up north here with
Well,
our
my
roads.
question, yeah, I mean,
Go
I have the
ahead.
same concerns. But what is the BART company going to do now? Obviously, we voted an extra amount originally to help buy these new buses, but they never got them. Are they going to come back and ask for more money, or are we going to
Not
have to
yet.
make that decision
Yep,
again,
not-
whether we go with fossil fuel or electric?
Yeah, so I've been working with Bart. So what we did as a county is, in order to get some of the infrastructure here that you would need for electric, which the state and the feds paid for, all of that, we as a county said we would support an electric bus if they were to get here. Obviously, it's been a longer timeline than when originally. So when we originally approved everything, the cost of the electric bus was about 40,000 cost share, and I think gas was about 29 or 30. So it was 25% more, about $10,000. There's still not that much more than that when you do all the grants and everything with it. So as of right now, no, the problem we're having is we approved ARPA funding for it, and we have until the end of this year to spend the ARPA money. So what I've been doing is working with Bart to say, in order for us to distribute our ARPA funding and not get out of compliance, we may want to switch that to ICE or a bus so that we can distribute the funds so that we're within compliance. And then they do come back every 2 years to request a bus, which we're working with Health and Human Services and their grant funding, that we have money each year that we set up aside, hopefully, 'cause if depending on costs, that would offset that.
Yeah, and in the meantime, I mean, when they came to us for, to decide on what we were going to support, their buses were getting old then. So they got to be getting really
Yeah, we
wore
did.
out now.
We've this year's budget or last year's end of year budget, we did buy another bus with them. I think it was like 29,000. So we had two in the hopper, I guess, through ARPA funding. We had one gas and one electric. So we've distributed one gas.
So who's going to make the decision? Or are we just going to wait and see what happens and then
We'll have
let
to
them come
wait
back to us?
Yeah. Yep. But we'll wait and see. It'd be executive for the first one because that's the ARPA funding. But then they'll request through TCC and this committee that you guys request through whatever budget means, and then we'll bring it to executive.
Yeah, I mean, as long as there's a clear path.
Yep. Yeah. Nothing's out there like they're struggling with the bus right now. Part of the problem is it's hard to get buses. After the TCC meeting, because we did talk about budget for 2027. Right now, there was no initial. At that meeting, the thought was there would be little to no increase in request from the county / the other municipalities. The day after the meeting, I did get an email from Bay Area Rural Transit, and it was from the federal government saying that there's a potential 30% cut in this funding for 2027. So between rail and public transportation, the feds are cutting, I think it was like 70% of the rail. I'd have to pull up the email, but it's a significant cut in public transportation, which will cause us to have to make decisions on this program and or the number of routes. So,
Well, not to take up any more the TCC update, I personally, and from the county board, I think there should be more. We should look at this more, especially, I mean, if you're talking about a bus that you're going to be opening the doors and it's going to be cold and I mean, it's cold up here and our roads are always messy. And so if
it's
gonna
not
put a
that
drag,
much of a
no.
degradation. And in town, you're not, you're
Yeah.
fine. It's if you were to go to Minocqua, you'll
Minocqua,
see
sure.
20%, but that's not going to be the electric bus. The other thing they're looking at with the electric bus is it would only have one door. So if you ever rode on a city bus, when you walk in, it's flat and it walks right to the back. There's no stairs, no nothing. A little ramp comes out. So then a wheelchair could go right in. The buses they have here, it's like 5 or 8% cheaper to buy buses that are not, what do they call them, ground level. So you'd walk in, if you're able-bodied, you walk in, you go up 2 steps, whatever it is. But if you need wheelchair access, the whole side of the bus opens or the whole back of the bus and the whole thing comes down. Well, you pay a little bit more not to have that extra big door. And that's what this electric would only be one door, which then you don't lose the heat from the whole back of the bus because you're only opening a
Okay.
car door rather than a garage door.
Well, maybe it's a good thing that it's delayed in coming here because these kinds of things.
Oh,
come to mind, you know.
I would say you're not losing. It's not a detriment to have that technology up here. I've done it for over a year. It's even in the bus, as long as you got the right equipment.
Okay. Okay. All right. Anything more, Patty?
No, I think we're good.
Okay. Thank
All
you.
right.
Thank you all. Let's go to Chana. You are back there with the behavioral health unit. And that'll be this,
Just
folks.
a quick update. So I looked at the email so I get the percentage right. So it says the President Trump poses significant cuts to public transportation and passenger rail funding in fiscal year 2027 budget request on April 3rd, blah, blah, released a fiscal year budget. So 16.3 billion or 23% for public transportation and 2.8 or 82% from passenger rail for 2027. So it's significant when
Yeah.
it comes to, and a lot of it came out of capital repairs. So just a.
Okay. Thank you. All right, Chana, it's your show.
That's okay. Hi, everybody. So my quarterly report, So far this year, we have had 30 crisis calls, 8 in January, 11 in February, 11 in March. And an unfortunate trend was that emergency detentions were increasing. I will say the trend for this month isn't great. We've already had 4 or 5 crisis calls at least. So 2 of which were last night. So you never know what's going to happen there. Intensive supervision program. So that's the program we provide counseling and supervision for people that have had second offense or higher OWIs. We didn't have anybody in the program in January, February. We have one enrolled currently. That's going well. Comprehensive community services, as you can see, that program is continuing to grow. There are 26 cases currently. Actually, that's probably even higher as of the last week or so. Community support program, we have consistent number of 20. I did find out they're losing the part-time case manager at Aurora, so we will have to find a way to accommodate that. Because by statute, the caseload can only be 20 and we will only have one person. So we're gonna have to find ways to accommodate possibly within county through targeted case management or something to manage those people until we can get them into that service. Coordinated services team, we're staying consistent at about 9 kids in that program. And children's long-term support waiver, as you can see, continues to grow. I know Bobby Joe was out on a new case this morning. I think Austin is working on another case or 2 to enroll in that program as well. So in March, we were at 67. We're probably approaching 70 at this point. 71. Okay, yeah, because I counted referrals and stuff for you, right? Yeah, so yeah, 71. So that program is large. And that's a program that technically by what the state requires, we're not allowed to have waiting lists for those kids or anything. And like Kayla said, through Children's Waiver and CCS, we're trying to, those kids are involved with our unit, they're involved in Kayla's unit for various reasons. Either it's severe emotional disturbance is like a category. So it could be autism, it could be behaviors related to mental health. And it's been challenging, that's for sure. But my staff are doing a great job in trying to work through that. We meet consistently with children and youth to try and discuss plans, just to see whatever resources we can pull. The one thing, as Kayla mentioned, we have some trouble getting providers to do, like say a respite, that kind of stuff, provide some supportive services in the home. So it's a challenge we work with all the time, but we're doing what we can. Birth to 3, there were consistent, we're up to 8 cases right now. And I feel like we might have just gotten another referral in that program also. So any questions on anything or anything about programming or anything like that?
Nope, but I think you need to talk about the next one.
I
Oh,
think
you're-
Sarah's talking about it, but I'll stay.
Okay. Thank,
Yeah, I want her to stay.
thank you. Oh, you're going to stay here. Good. But thanks for that. Okay.
You want me to stay up here? Doesn't matter.
You're fine. Okay, good.
So the next one is where I am asking for a position for the CLTS for the Children's Long-Term Support Waiver. Like Chana had said, Chana and I had worked and we looked at there's 71 cases that are open right now. And the state indicates that it's cases is up to 20 to 25 cases per worker. I know that Chana has had a few cases distributed through the other workers to help, but unfortunately their caseload is growing and they're at capacity. So Carrie did a work with a lot of numbers and looking at it does not have tax levy. And I don't know if Carrie, you want to talk at all on numbers that you had found, but Just recently she did that, but there's no tax levy in having another worker come in. It's covered, the expenses are covered through the COP, CLTS, the reconciliation. And so that's what I'm requesting to have move on, because we're gonna burn our worker that has this doubled and a half caseload. And pretty soon we won't have, there's no waiting list. We cannot have a waiting list. The state, actually, I was kind of looking back at one of my directors meeting, and I know that Taylor County ended up having some issues with the state. They had, I believe, some money removed possibly for this programming because they had a waiting list. So
So you're saying there's no cost, basically?
that does, no.
So
The
what do you
only
need-
cost we might have is a setup cost of about $3,500 is what we kind of came up with, but we might be able to cover that in there as well. Yeah. Yeah.
So what do you need from us today? I should let Paul ask you questions. I'll stay out of it.
Don't get
I-
excited.
I-
man. You get to make these
Well, it
decisions.
sounds like that we're in
Yeah.
dire straits and
Oh,
we need
we've
to
been
make,
talking about
do
this.
some
This is
action here
Nothing
today.
new. You guys have
So
been
I
hearing
believe
this.
it's gotta go
Sounds
to
like you need
admin.
two.
Yeah, well,
additional.
when you look at those numbers,
It's very, yeah.
we don't want to lose a good worker. We really don't. And folks, we have to do something. I mean, this has been going on and on. Joel?
To Dennis's point, for the workload, it does seem like we need more than one. Would two be covered by this funding?
I believe
Yeah.
it would be.
So
how hard are people to find is another question.
Right, that's what we need to advertise soon and fully, I don't know. It's a good timing right now because of graduation.
Yes.
So that might be a positive time right now to get it out there.
And it might help a staff member feel better knowing that we're looking.
are
You
you,
know?
Yeah.
are
Yeah,
you
for
looking for a motion to move it to admin?
Yep.
I would make that motion.
And second, any discussion? Shouldn't be any. All the, all those, all those in favor? Those opposed? Shouldn't be any.
So we're timing this out. So we brought it here. You guys made a recommendation. Is it for one or two? I didn't hear, but we'll then have a resolution at admin. Admin will bring it to the full board at the second meeting in April. So then we can advertise after that.
Just clarification, was it for, is it a motion for one or two?
I
Joe?
would make them, if I can yet, I would make the motion for two.
Just add it in there. Two.
Up to two,
Up to two.
up to two. So they have
And
the
it'll
Do you
option.
agree with
depend
that?
upon Interviews and how many good candidates you get and everything
Right.
like that. I mean, you're not gonna hire just to hire.
Get-
Yeah, this is this Bobby, Joe?
Yes.
Yeah.
Microphone.
It is on. I'm not talking into it though. I'm over here. Thank you.
Can I ask just a quick question, what the qualifications are for this position?
It would be a social.
Social worker, okay, thanks.
Yeah, and when we were talking about this last time, we were at 60, now we're at 70.
I know. And that
I
bothers me.
can't
Just-
imagine how
it-
she's doing all this stuff.
No.
Okay, let's get it done.
You authorize up, we would start with one and see where it goes.
I think that's how, up to
Yeah.
two, yeah. Okay. Okay, I was hoping it would go that quickly. I was hoping this wouldn't be something, so, okay, good. Okay, Carrie, now you can come on up. And this is what she had, high class placements.
Before Carrie starts, with those two new people, we'll also need a new normal building because we don't have enough space, right?
There you go.
I'm kidding. Sean is like, where am I putting these people next to me?
We're gonna put a divider down the middle of your office.
We'll share.
Thanks, Jonna. You're welcome.
Yeah, no, I don't think so.
Microphone, yes.
I also said I'd come over here too, but
Yeah.
No,
No, I'm keeping her own.
You want right there, right?
okay, so in summary here we have our high cost placements. They do kind of
reflect the reports that Shauna and Kayla had given. Again, these are about like a month and a half behind, just how we end up paying the bills. So you'll start to see them catch up a little bit. We do also have our final 2025 numbers on there as well. Both came in a little bit over budget, but that was to be expected. Were there any questions?
No?
Thanks.
Is that your whole report? Is that it?
Yeah.
Questions at 6
Wait a minute. I got an email at midnight one time.
From home?
You.
At midnight?
Didn't that come at midnight?
Oh, I don't know. I've been doing stuff at 2 a.m, so
Maybe it was 2. It
don't
was
know.
like,
Yeah.
geez, Bob, you
The-
gotta go to
what
bed.
What surprises me is when I get a response.
I know. Yeah.
What's the budget in the AODA? Same as last year?
I believe so.
It's not on your report. That's why I'm asking.
Yeah.
Yeah, I can double check on that. I do think it is kind of roughly around.
Don't
the
have
same.
that off the top of your head.
I thought we
Wow.
adjusted it slightly.
Yeah, this time of the year, I told Sarah I don't trust my brain. I go back and check everything this time of the year.
Carrie put it's the same. It's on the right side of the
It is the
report.
same?
It's on the right side. I getting a message right now. It says it's on the right side of the report, all the way to the right.
Right here.
Mm.
Yep. It's there.
Thank you. It's a wonderful report.
Yeah. But I do miss all the squiggly lines. Remember all those? Yeah. All right. Thank you, Carrie. And now we have the director report. Sarah. You have the microphone.
All right. Well, I mentioned already about the children and youth. Next is that Tiffany was appointed to the Rural Health Transformation Program Advisory Council advocate for the health programs for rural counties, which is great to have a spokesman for ours. There was 194 applications from 62 counties and 23 were appointed, and she was one of the 23.
Nice
So
job.
that's
Good.
awesome.
Nice to have a voice from up north.
Yeah. And I believe that you already heard from Dawn is our ADRC specialist has resigned / retired. And so we are taking applications to April 15th at this time. So that is the end of my report. I was trying to be faster than Carrie.
Yeah. Well, I want to say so that now with the election, this is our last meeting as this committee, as we are. Maybe there'll be changes, maybe there won't be from board members.
No, so you're all appointed 3 year. This
Oh,
one
so
doesn't
we'll be here for 3
change.
years? Oh, well,
Well, it'll be staggered, but this is an appointment, not through
Okay.
that process. So
okay, so,
everybody right now is not ending a term.
okay, scratch that. Okay. And we'll continue. All right, then our next meeting is May 13th.
One more thing.
You got to go to back to
Vouchers.
Got about vouchers, thank you. And we have to get that to Robin, so we'll send that over to Robin. Okay, motion. Are you making a motion, Joe?
I will make the motion.
Well, he handed them to me. Okay, motion's been made to accept the vouchers as presented.
Second.
And second by, we'll take Patty this time. Patty, any discussion? I think we kind of beat them down. All right. Hearing none. All those in favor?
Aye.
Those opposed? Good. Next meeting's May 13th.
I have one thing under the appointments. We did pull Sally's original or last
Oh.
letter, so it did say her term of office will expire May 31st, 2026. So there should be no issue with
Got it.
lapsing. So
Okay, so it's
those
just-
were already done in
All right.
2023. So we had
Perfect.
changed it then.
All right. So without any objection, this committee is adjourned. Have a good day.